Jersey Shore's hit music channel, 94.3 The Point. Well, there's a law that requires public and charter schools that include grades 9 through 12 to provide instruction in CPR and the use of automated external defibrillators. And we have joining us today Dr. Dawn Calderon, Chief of Cardiology at Jersey Shore University Medical Center, and Charlie Melita join us. Guys, welcome to the show.
Thank you so much for having us.
Thank you, Lou.
Charlie, I want to start with you. Tell us the story of why you're here today.
Sure. Unfortunately, my wife Beth and I lost our son Robert at the young age of 21 back in December of 2012 from a sudden cardiac death. And quite honestly, Lou, the community support that we received was unbelievable. We received everything from meal trains to memorials. And it was actually that support that helped keep the Melita family going during that tragic time. And it was because of that tremendous support that Beth and I wanted to find a way to give back to the community. So since our entire family has been involved with Riverview Medical Center for over 20 years, I reached out to my contacts there, and they put me in touch with the community outreach team at Meridian Health. And then collectively, Lou, we put the wheels in motion with Dr. Dawn here to make Rumson-Fair Haven High School, our son's alma mater, the pilot school for Meridian's Community of Lifesaver program.
So, Dr. Dawn, talk about the program and talk about why this new legislation is so important.
We're so excited this finally got signed into law. New Jersey is one of only 11 states in the country that requires this. And sudden cardiac death is, as it says, sudden. It can happen anytime, anywhere. And simply there just aren't enough medical people around that are going to be around to help resolve this situation. So we've learned from all of our research and all of our outcomes study that the sooner you get treatment started, the better the outcomes are going to be.
And the American Heart Association estimates that there are approximately 100 student athlete fatalities each year from sudden cardiac arrest. That number was shocking to me.
It's not just 100 people 100 kids that are dying from this. It's 100 families that are affected forever. And having been on the side of meeting with the families and telling them, it takes one time to see just how absolutely devastating this is, not only to the family, to the entire community, and we're trying to help change that.
And you're doing that through the Community of Lifesavers program.
Right. So what we're doing is we're teaching mass numbers of people how to do CPR, how to use a defibrillator, and to instruct them to call 911 and get things going before the first responders get there. You know, we all live down at the shore, and we know the shore traffic, and if you can imagine how many minutes it takes when some kid goes down to get advanced life support there, that could be 10, 20, 30 minutes, and we know that without oxygen, there'll be brain damage within about 6 minutes.
And there have actually been some life-saving stories.
We had a wonderful outcome from all of the efforts in kids learning CPR, though it wasn't directly from our program. At Meridian, we recently had 2 young people in separate incidents that had sudden cardiac events. One was from a cardiac-based, one was from a severe asthma attack. Both the teenagers were saved by 2 other teenagers. So our point is, when kids are trained to do CPR, it works.
Now, for the parents listening and wondering what it is that they can do preventatively, what about screenings? Do screenings work for young kids?
It would be great if screenings worked. We're still involved in the research. It's kind of not ready for prime time. So while we continue to figure out what screening actually works, we don't want to give people a false sense of security. We don't want to give out misinformation and massive screening of kids. Where do you stop? With echoes, with MRIs, with all of these things? It's just not feasible. It's not practical. So since we can't predict this, we cannot prevent it. So we need to know how to treat it.
Now, if people want more information on the Community of Lifesavers program, what's the best way for them to get it?
If they just check out the Meridian website, there'll be all kinds of information there. If they want one of the programs run at their school, get on the website, call Meridian, and we'll get you in touch with our community outreach people.
All right, we are talking with Dr. Dawn, Chief of Cardiology at Jersey Shore University Medical Center, and Charlie Melita. Charlie, I just want to say to you, thank you for the courage to tell the story and for the courage to do something about it. It is really a great tribute.
Thank you, Lou, for the opportunity to talk. And we got the program off to a great start. We successfully trained over 700 students in one day at Rumson-Fair Haven High School. And the program had so much momentum behind it, the students actually convinced Meridian to do a program for the parents one night, and also just recently completed training for all the faculty and administration at the high school as well.
A lot of great work being done, a lot of progress being made, and I just think it's wonderful. Guys, thank you so much for all that you do and for coming to join us today.
Thank you.
Thank you, Lou.